but coordinating with syringe exchange programs is a big part of my job, so I'm excited to share this work. I'm going to be going a little quickly because there's a lot of ground to cover, but so I want to make sure that we get through everything, but also hopefully have time for questions. If we don't have a ton of time for questions at the end of the presentation, please feel free to take down my email and my phone number, and I'm happy to answer questions after the fact. So, first, just some brief background on opioid use in North Carolina. Overall, unintentional medication and drug deaths increased by 350% between 1999 and 2015, and the number of heroin-involved deaths increased over 800% in just 5 years between 2010 and 2015. So this graph includes our most recent 2016 data on overall unintentional opioid deaths in particular, with a breakdown by type. Heroin, fentanyl, and other synthetic opioids are now involved in over 50% of opioid deaths. So we are seeing a transition in the drugs that these deaths are attributed to as the epidemic progresses and evolves. Of course, fatal overdose is not the only indicator of increased opioid use or increased injection drug use. When compared to the previous slide, we can see that starting around 2010, the number of acute hepatitis C cases in North Carolina rose alongside the increase in heroin use. So when faced with these realities about the opioid epidemic, that more people are overdosing and dying from overdose, that more people are using and likely injecting heroin, and that hepatitis C, which is very easily transmitted through shared syringes and other injection supplies, that hepatitis C infections are up. We have some questions to address these health issues. So we clearly need to support preventative measures and access to effective evidence-based treatment for substance use disorders and addiction, but we also need to create health services for people who are using drugs and injecting drugs and who are at danger for these health problems and a variety of others as well, regardless of their ability to or interest in accessing treatment. So it just so happens that syringe exchanges are an effective and evidence-based way to provide these services and to improve and preserve the health of people who are using drugs. So early question might be, why do drug users need specialized services when you can just get syringes prescribed by a doctor, or you can go to any primary care provider or health department to receive testing for hepatitis C or HIV? Because of how drug use and drug users are stigmatized and criminalized, getting medical care and accessing other social services becomes difficult. Providers may only see you as your drug use and ignore other health issues, which we know limits care and endangers patients. The same can be true for accessing social services related to employment or housing or receiving legal protection. So I've posed this question to public health people in the past, so it may not be the best population to do it with, but we're all familiar with going through a doctor's appointment, and the doctor or PA will ask, how much exercise have you gotten in the last week, or how many alcoholic drinks have you had? And we, as public health people, know that doctors are covered by HIPAA, and they're not asking in order to get anybody in trouble, that they want to be able to provide care. But even I, knowing that about providers, and I'm sure lots of other people knowing about those protections, may have trouble sharing information about even legal activities that we're doing if we know that they are stigmatized or that we might be judged for them. So it's difficult to expect people who use drugs to talk openly about their use and to access medical care and other social services through mainstream or typical providers. There you go. So syringe exchange programs provide an alternative to mainstream medical settings for people who are using drugs or injecting drugs to receive medical care and to be connected with other social services. Syringe exchange, also known as needle exchange or syringe access services, there are a variety of names for these programs, have been around in different forms since the 1970s as a way to prevent the transmission of bloodborne diseases through shared injection equipment, first to prevent hepatitis infection, and then used during the HIV epidemic to prevent transmission between injection drug users. So many of the risks that we associated with drug use are more associated with the conditions in which people use drugs. So on its own, heroin use doesn't lead to greater susceptibility of bloodborne infections. But if you make possessing a syringe illegal, or if you make them difficult to buy, people will turn to reusing or sharing supplies, which is where a lot of these risks come from. So syringe exchange programs reduce some of the harms associated with injection drug use by providing unused syringes and injection supplies. I'll go in a little bit of what I mean when I say injection supplies, by reducing supply sharing and reuse, which can cause all sorts of infections. So syringe exchange programs were legalized in North Carolina July 11th of last year. We just marked our 1-year anniversary. In our first year of legal exchange, we've had community organizations, churches, and other faith-based groups, aid service organizations, treatment centers, and other healthcare facilities, and health departments signed up with the state to provide these services. I'll get into some of the technicalities of the law and what legal expectations for syringe exchange programs are, but I think something that's important to highlight is that in addition to legalizing exchange and specifying requirements for programs, the law also provides limited immunity for participants and staff against prosecution for possession of drug paraphernalia that if it was obtained through or is being returned to a syringe exchange. So this is really important for 2 reasons. One, it legalizes people taking supplies out of a syringe exchange and having unused syringes and other injection supplies on them if they're stopped by law enforcement. But it also, because the limited immunity also applies to drug paraphernalia that may contain drug residue, it also encourages people to feel comfortable taking their supplies back to an exchange so it can be disposed of safely through an exchange program. So the most basic level syringe exchange programs provide a safe place to dispose of used syringes, like I said, and to distribute unused syringes to reduce syringe sharing and reuse. But I and many harm reductionists, and I'll explain that term in a second, see this service as a way to initiate conversations with people injecting or otherwise using drugs. And these conversations and these relationships encourage the use of other health services and harm reduction practices in an environment without stigma or judgment. And so all of these connections that can be made through a syringe exchange program are harm reduction resources for people who are injecting drugs. So harm reduction is the guiding principle behind a lot of syringe exchange work and a lot of work involving current injection drug users or people who are otherwise using drugs. There's a lot of great work around harm reduction and developing those kinds of programs and perspectives when it comes to working with high-risk populations or marginalized people. But I think the easiest way to understand harm reduction is by the phrase meeting people where they're at, which many of you may have heard before. Understanding that people are going to be using drugs for a variety of reasons and for a variety of contexts, and we may not always agree with them, but people are often coming to drug use with valid reasons of why they're seeking support. So instead, while we recognize that we can't identify and fix every problem or take down all of the barriers that people are having to treatment or to discontinuing their use, we want to make sure that they're being as safe as possible to limit the harms on themselves and to the people around them and their communities while they are using and until potentially they are ready to enter treatment. So this is a little bit of an estimate right now, but I think it's a good indicator of where syringe exchanges are operating in the state. We're trying to keep track at the Injury and Violence Prevention Branch of which counties are served by syringe exchange programs, and I'm very lucky to be in contact with our programs and to receive regular updates about where they're working and how best to connect people with those services. We just went through our annual reporting process, which I will talk about a little bit, and through that information and through those reports, got a better sense of where people are coming from to access syringe exchange services. So even if a program is based in Fayetteville or in Asheville or in Greensboro, there are people who are coming from very far afield to find those services because they may not exist somewhere else, or if they're coming from another state, they may not be legal there. So this map will be updated, and we're working with the EPI people that you may have been in contact with in our office to get a better understanding of where syringe exchanges are active. And since we have so many health departments on the line, I wanted to put in a plug and say that I will be following up with health departments. If a syringe exchange has indicated that that they are getting participants from your county, I will be getting in touch to make sure that local law enforcement know about the limited immunity and trying to protect people who are engaging in legal syringe exchange programs, but also to help you at health departments connect people with treatment or connect people with other resources, and so that you know what syringe exchanges are operating so that you can refer people to their services. Many of you have probably heard about the STOP Act, which was signed into law at the end of June. It contains a lot of preventative measures to better regulate use of and access to opioid pain medications, focusing on short-term prescriptions for acute pain. So there's a lot of preventative efforts here. But the STOP Act also changes the language around the use of public funds for buying syringes and injection supplies. So federal money, state money, local money could always be used for other kinds of operations, paying for rent or paying staff, buying other kinds of supplies, doing testing and treatment, making referrals, stuff like that. But there was a prohibition on all public funds in North Carolina being used to buy syringes themselves and injection supplies, which may include tourniquets, cookers used to prepare an injection, cottons which are used to filter an injection to try and prevent detritus from getting into your bloodstream, alcohol swabs, stuff like that. But now there's local money has been opened up for use of buying those supplies. So still the prohibition on state money being used for injection supplies, but the language is now specific to state money, and so local funds can be used. Please also get in touch. I know that this is kind of new, so please get in touch with me or with Anna Stein if you have any questions about the legal and money aspect of this. You also may have heard about the Opioid Action Plan that was just released. A lot of great work has gone into this, a lot of evolving ideas and good ideas coming together in one place to map out how we will address the opioid epidemic over the next 4 years. But wanted to shout out that an action item is increasing the number of syringe exchange programs in the state, and that many other areas of work, including increasing naloxone access, increasing connections to treatment and other care, providing follow-up care for people who have survived an overdose, and creating peer networks for those people can also be done or aided by syringe exchange programs. So a lot of ways to come at this work, and syringe exchanges are a great first step. So Division of Public Health's role and responsibilities under the syringe exchange law and program implementation are organized under the auspices of the North Carolina Safer Syringe Initiative, which is developed in partnership with the Division of Mental Health, Substance Abuse Services, and Developmental Disabilities, the Communicable Disease Branch, and the North Carolina Harm Reduction Coalition. So a great name for a lot of work being done. and covers a lot of ground. So briefly, the syringe exchange law does spell out some responsibilities for Division of Public Health and some, bear with us for a second, thank you. These roles include receiving sign-up forms from new programs and explaining the law to people or organizations that are interested in starting exchanges, including explaining the limited immunities that the law provides and making sure that participants and staff are covered, explaining program requirements, and introducing the available resources and supports that are at DPH. Working with people interested in starting syringe exchanges or other syringe access services in terms of assessing readiness and designing programs. Lots of great instances of this from our first year. People who had heard a presentation from someone else in the office and realized that syringe exchanges were legal and wanted to pursue developing their own programs. Something that I'm really proud of is being able to work with the Eastern Band of Cherokee Indians, and they are implementing a syringe exchange program now, and it's been really great to learn about their healthcare system and to work with them to put that into place. Moving along, working with partners and programs, we've been able to provide letters of support for syringe exchange programs, seeking grant funding. I've gotten questions about from health departments who are working in concert with syringe exchange programs about finding insurance coverage, connecting people with field experts or other sources of information to help them move their programs along. So the technical assistance aspect is a big part of what I do, and I'm very glad to hear about the different work and different stages of interest that people are in and to help you move along. Syringe exchange programs are very local and tend to operate very independently. So part of developing the Safer Syringe Initiative and kind of fleshing out DPH's role in syringe exchange programs is trying to figure out what we can do at a state level to encourage and support these programs, because we're not able to be on the ground fielding a lot of the questions and dealing with some of the issues that programs have. So far we've been able to have conversations with the Office of EMS about expanding or creating some kind of mobile exchange service that EMS providers and ambulance operators can provide, which is a really wonderful idea, specifically because many of our syringe exchange programs are based in urban areas, and we recognize the need for these services in rural areas or where people may not have such easy access to transportation. I'm working with the Faithful Families program that's also run out of the Chronic Disease and Injury section, potentially introducing some curriculum or language in some of their work that goes out to faith communities across the state around harm reduction and about providing services to people who are using drugs. So trying to look at those bigger programmatic level partnerships that we can create and get this information out in different ways. And finally, one of the other responsibilities laid out for Division of Public Health under the Syringe Exchange Law is administering the annual reporting period. Under the law, programs are required to submit an annual report to the Division of Public Health that provides some information on what their operations have been like in the past year. Questions about how many unique individuals have been served, naloxone kits distributed, numbers of needles returned and distributed, and then we asked some questions about their referral systems and other organizations that they're working with, and some operations questions. So that annual reporting period just ended. The deadline was July 31st, and we're going through some of that information now and following up with programs. It's been really wonderful to see the work that people have been able to do, oftentimes in less than a full calendar year, because these programs have been starting throughout the past year, and often with very limited budgets or very limited staffing. So it's a great I think it's a great first year for these programs, and I'm very excited to see what what else is in store? So the law lays out some requirements for syringe exchange programs. Obviously, syringe disposal is a great resource for people who may not otherwise know how to dispose of used syringes in a safe way. Distribution of clean syringes and injection supplies, and this italicized language is important, that these services must be provided free, and the sufficient quantities line. There are models of syringe exchange where people are required to bring a used syringe in for every one clean or unused syringe that they receive. That's called a one-for-one exchange. We know from research done on those kinds of programs that the intention is to make sure that people are disposing of syringes in a safe way and trying to reduce the danger to public safety. In reality, those kinds of limitations just prevent people from actually having as many syringes as they need to stop sharing or reusing supplies. So one-for-one exchanges are actually technically illegal in North Carolina because we know that those programs don't work as well as when we just give people as many supplies as they need. Programs are required to distribute a security plan to police and or local sheriff's departments within whose jurisdictions they operate. We want to make sure that local law enforcement know that syringe exchanges are legal now. This is an ongoing education effort to get everybody up to date with the new law and the protection that the law provides for people who may be carrying syringes. So this is a way to make sure that programs are set up to keep themselves and their participants safe in terms of supply storage and keeping any records that they may have secure, but also just notifying law enforcement and assuring them that these programs are legal now. Programs are also required to provide educational materials about both transmission, prevention services and techniques, as well as treatment options for mental health and substance use disorder. Programs either have to connect participants with a place to get naloxone by providing referrals or provide naloxone directly to participants. I know from annual reporting that some programs will have a combination and say, well, if you're someone who does not have insurance or is directly affected, and we want to make sure that you have naloxone around in case you're with someone who overdoses, that naloxone is provided free through the program. But if you're someone who is, a concerned family member, if you're someone that is able to buy naloxone from a pharmacy, a program may have a combination of referrals and direct distribution. And then finally, programs are required to provide consultations and referrals to mental health or substance use disorder treatment, taken with the harm reduction angle, making sure that those consultations and referrals are provided when a participant is looking for them and ready for them, and not providing those consultations or referrals as a condition of participation. So the North Carolina Safer Syringe Initiative website launched in January. The website features general FAQs for program providers, health departments, the general population who may be learning about these programs and trying to figure out what exactly it is they do, the explanation of the law and the program requirements that I just discussed, toolkits and guidance documents for agencies interested in starting programs. The annual reporting and the sign-up forms are available there as well. But most usefully maybe is the programs list. So you can see under that blue box on the right-hand side, or within the dark blue, the first link is Syringe Exchange Programs in North Carolina. And we keep that up to date with programs that come online and ones that maybe are going offline, and provide contact information, the counties that they're serving, and that information will be updated as well as we get some of the annual reporting information processed. These are some of the documents that are on there. Quick answers for law enforcement. If you are a health department or other agency who wants to work with law enforcement to encourage this education effort, there's information there specific to an officer who may encounter someone who's participating in a syringe exchange program, and explain some of the benefits that there are to law enforcement when these programs are implemented. Something I wanted to focus on is the participant cards and limited immunity document. If you have questions about this, I encourage you to read through the whole thing. But the text of the law is a little tricky because the limited immunity only applies to someone if they are able to produce written verification that they are participating in a syringe exchange program, but does not lay out exactly what that written verification needs to look like. So I can't think of any alternatives that I've seen. It doesn't necessarily have to be an identification card or a participant card, but that's certainly what these written verifications tend to look like. As I said, having protecting people's identity and providing these services anonymously is very important for a lot of reasons. Someone may be hesitant or unwilling to provide their full name when accessing syringe exchange services. So participant cards may be an anonymous identification code that is specific to one person but is not identifiable. So perhaps the first two letters of my mother's maiden name and the first two letters of my last name, plus the year I was born, and perhaps some programs will have a demographics identifier attached to that code so that someone from the program can tell easily whether or not that code belongs to that person. We encourage participant cards to include some sort of information about the syringe exchange law, either the number or a link where you can find it, or an address where you can find it, so a piece of information about the limited immunity, something like that. So really, so it looks like a real card. We've had some instances of law enforcement not believing that that card is from a real program. So the realer that you make them look and the more legitimate you make them look, the better protection it can provide for one of your participants. And then there's a number of documents and resources available for people who are interested in providing syringe exchange services. The models document runs through some of the different ways that you can provide these services, depending on what is most appropriate for your location and your capacity. There's information for doctors and other healthcare providers about connecting people to these services, and ways to introduce harm reduction and other kind of syringe exchange ideas to their interactions with people who may be using or injecting or otherwise using drugs. So there are a number of toolkits available. We're developing some resources that are useful specifically for programs in North Carolina, including a framing document which will share some of the information from the law enforcement page and the providers page about, making the case to someone who may not necessarily agree with or believe in these kinds of programs about why they're beneficial and why they work so well, as well as a startup document which will cover some of the following steps. So if you're interested in starting a syringe exchange program, and I know some of the people who are on this call, and I've had the great fortune of working with them and talking to them about this process and what to consider before going into starting a program. My very first piece of advice always is to visit an active syringe exchange program. There's a lot of attention to syringe exchange right now, which is wonderful. I think these programs are receiving a lot of overdue credit for the work that they've done. But it is a lot of work to take on. There's a lot of things to consider. So visiting a syringe exchange program is a good way to kind of get a ground level understanding of all the work that goes into it and what kind of services and capacity you need to have to be able to provide these services well. So if you're able to visit an active syringe exchange, you can talk to people who are accessing the program have conversations. I think the opportunity to have conversations with participants and staff is the best thing about being at a syringe exchange, and just sitting and having talking about the experiences of someone who's using drugs, accessing healthcare services, or, you know, if you're a health department and you really want to start an exchange, talk to someone about, you know, how would you feel if there was a syringe exchange at this health department, or what does it feel like as a person who's using drugs to come in and you know, ask for HIV testing or ask for hepatitis C testing, being able to have some of that firsthand knowledge. And you can also, see how programs best adapt to their locations and to their capacity, whether it's a mobile exchange, if they're not able to have a fixed site, if they're operating out of a van, you know, that has its own benefits and challenges. If it's a long-standing program that might have a drop-in center that might serve as a meeting place for other kinds of health programming, that's great and comes with its own benefits and challenges. So being able to really see firsthand what goes into these programs is the best way to figure out if they're right for your community or if they're right for your health department, and to go from there. Identifying your local partners and referral network. Some of this is part of the formal syringe exchange setup process, so you need to know where you are referring people to for mental health or substance use disorder treatment services, what kind of other partners you might be able to refer people to for low-cost healthcare, nutrition programs, job training, stuff like that. But I think it's also a good way to identify, if you don't already know, what organizations in your community or in your area might already be working with people who are injecting drugs, which includes organizations that do homeless outreach, AIDS service organizations, clinics, rural health agencies, faith-based groups, treatment and recovery groups, legal services as well. Trying to get a lay of the land in your region to see what kind of services you're able to provide to people and which partners you might be able to best work with. You also want to answer the question, where does it make the most sense for a program to be housed or based? What kind of model makes the most sense based on capacity and resources? What kind of resources can you combine that the syringe exchange doesn't have to provide itself, but can easily refer someone to elsewhere? And what kind of connections you will need to be able to provide to participants. Need to know about local detox or treatment facilities, healthcare providers. If you are distributing naloxone, how best to get naloxone. If you are referring people to naloxone, identifying pharmacies in your area or health departments that may be dispensing naloxone. So having all of that together and understanding the local capacity. This is also, very importantly, the opportunity and necessity to involve directly impacted people, identifying the people who will be served by this program and who will best benefit from a program like this. This is where you will identify a lot of your volunteers. Syringe exchanges are very typically run and get their best services and workers through volunteers. What kind of staff you'll be able to support and provide, identifying people to work as peer counselors. This is great to have in the routine course of syringe exchange services, but also specifically for post-overdose response teams, having someone with lived experience who has perhaps overdosed themselves or who has gone through treatment themselves and who has an understanding of harm reduction work and is able to provide firsthand knowledge. A huge piece of harm reduction, really centering people with lived experience, and is of great benefit when you are delivering services. I should add, I'll give a shout out to the health department that's on the call. When you are assessing readiness for a syringe exchange program in your area, this was an idea that a health department had and pursued fabulously to include a question in a community health survey or an opinion survey about having a syringe exchange program, trying to get a sense from the public of what the interest there is, where it might best be located, what kind of demand you see, so that can be really helpful in assessing readiness. So this is where you'll expand your network a little bit. Some newer independent programs that have come online in the past year have struggled with community awareness and being able to connect with participants and how best to identify and make themselves known to people who will be referred through other agencies. Working with local law enforcement to develop your security plans. Making sure that, or educating officers as necessary about the limited immunity, as well as other legislation that's been recently passed, like the Good Samaritan Law, making sure that people know that if someone is carrying a syringe and they make it known to an officer, that that person is protected from prosecution, education efforts like that. There have been some stories recently that I've seen about the burden that the opioid epidemic is placing on local libraries in terms of people overdosing at libraries and discarded syringes, because libraries are a very welcoming place. They're accessible by people with low or no income. So perhaps, talking to libraries or other people that may or other agencies that may be experiencing the opioid epidemic in other ways, who may be interested in partnering with a syringe exchange or harm reduction service to try and find some solutions to the problems that they're seeing. At this stage, you want to do your due diligence under the law and to be a good neighbor, to notify people and to make sure that you're protecting your participants well. But syringe exchanges also depend on discretion, and typically don't have a very high profile in a community. People like to show up and do what they need to and have the conversations that they want to have and then be able to leave without a lot of attention. So you don't want to draw too much attention to your program. You want to make sure that the people who need to know about it and can access it well. I will add through all of these steps that this is how we see it from the Division of Public Health, and these are obviously, very broad recommendations about how best to proceed with building up a program. But if you have questions about providing services in your area, or providing rural services, or identifying needs among people who are using drugs when it comes to other health or social services, talk to local syringe exchanges. You're welcome to contact anybody who's on that active programs list on the NCSSI website. I'm happy to connect you with different programs. They have been extremely helpful to new programs, to people who are interested in providing services. It's been really gratifying to see those connections being made and to have programs being able to share their expertise to benefit others. So I'm sure that many programs in the state would be happy to provide some support and question and answer to you or your agency if you're interested in starting a program. Fourth recommendation is to work to increase naloxone access. The STOP Act amends some of the language around community distribution that allows community distribution formally. It also allows health departments to distribute naloxone outside the walls of a health department. Previously, it had been restricted to public health nurses based at a health department operating under a local standing order to distribute naloxone, but now agents, quote-unquote agents of the health department, are able to distribute it in the community. So if you're a health department and you're not able to provide your own syringe exchange program, but you're able to partner with a syringe exchange or an external agency to develop some of these services, that's a good way to encourage naloxone access and distribution outside of the health department. let's see. So even if you aren't able to adopt a local standing order, you can also use the naloxonesaves.org website to identify pharmacies in your area that have elected to participate under the standing order and make naloxone available without a prescription over the counter. You can encourage pharmacies to sign up with naloxonesaves.org. You can put up posters with pharmacies to make sure that people know that naloxone is available there. If you're a health department and you received the patient education toolkit yesterday, that features a poster that you can share with pharmacies to let people know that naloxone is available. If you're a health department and you have a local standing order, making sure that naloxone is stocked and accessible to people who need it, and supporting syringe exchange programs or other agencies if they apply or seek funding for free naloxone kits or other kinds of services, being able to be a resource and a support for that. I think that's everything for that one. And then finally, the formal sign-up process, reiterating that I and other members of our team are available always. If you have any questions about this process, if you have any questions about signing up in particular, so on and so forth. The sign-up form is more of a checklist of things that you need to have in order before signing a program. It's really not meant to be burdensome at all on a program that's just starting out. With that and with the sign-up form and the annual reporting, we are trying to keep the burden on syringe exchange programs as limited as possible. So the sign-up form covers your plans for how you're going to acquire syringes. If you need help with that, I'm happy to assist. There's organizations that help with the wholesale purchase of syringes for syringe exchange programs. You can organize donations from healthcare facilities or local health departments, so on and so forth. You need to have your security plan put together. So a program will give us a copy and distribute it to the police and sheriff's office active where they will be operating. On the form, you need to be able to tell us how you're going to be disposing of syringes, the model and the active location, but that's pretty much it. We'll check your contact information. I'll add you to the list of syringe exchange programs on the NCSSI website, and you're ready to go. So syringe exchange programs provide a ground-level and indicated approach for accessing a population that is at risk. These programs create opportunities to normalize drug users and provider relationships while lowering stigma. So again, really just making the bridge between providing syringe exchanges to people who need them, but also creating all these other connections to other health and social services, in addition to the great kind of mental and community and emotional benefits that having a low stigma, low judgment, ideally no stigma, no judgment kind of environment and community can provide. I think something that harm reductionists and people who are involved in syringe exchanges really value is the opportunity for people who are using drugs who are really often denied their humanity or denied their autonomy because of how society sees them or how they are treated, to regain some of that independence and to be able to make choices and to be able to get accurate and helpful information and to have those just really basic conversations is extremely valuable. And so finally, I wanted to emphasize ways to support syringe exchanges even if you aren't able to start one. I know that it is a lot of effort and takes a lot of work to start a program yourself. There are many ways to support this work even if you can't take that on. You can donate supplies to a syringe exchange program that's operating in your area or even not in your area. Olive Branch Ministries is a fantastic syringe exchange program. based out in Hickory, and they're on the line, so I wanted to say hello and give them a shout out. At the Opioid Summit in June, one of their program leaders emphasized that, we use a lot of brown bags. That's what we put our supplies in, and they're not expensive, but we use a lot of them, and that's a cost that they have to incur when they're also buying syringes and trying to provide naloxone and all sorts of other injection supplies. So even something as simple as brown bags that you can donate is really helpful. Printing costs. People have to, are required to provide educational materials on all sorts of topics. Printing is expensive. If you are an agency that's able to help a program print every month or every other week, that's really, really helpful. If you're a health department or other agency and you can install a syringe disposal box and a biohazard so that people have an alternative place to dispose of used syringes, that's wonderful. Partnering with syringe exchange programs for testing events. A lot of programs aren't able to provide testing on their own, so being able to organize some regular times where the health department can support a program by offering a testing day is great. Adopting a standing order, again, and being a reference for participants where they can access naloxone, helping to notify and educate law enforcement about the program and about the limited immunity. And also just working with people who are using drugs contacted through syringe exchanges to really walk through local health department services and say, what are the barriers that you experience here and what are the things that we can do better or that we can change to make you more comfortable accessing these services and being able to really improve health in a variety of different ways. So syringe exchange opportunities is an opportunity for all of this great stuff. I encourage you to keep the conversation going, emailing me, emailing the Syringe Exchange NC email address, which is also mostly me. So just a matter of preference. Please visit the Safer Syringe Initiative website and see some of the stuff that we've developed, and also information available through the Injury and Violence Prevention Branch website there at the end. Thank you so much.
Thank you so much, Lily. Very much appreciate you walking us through all the aspects of the law as well as how to set up a program and giving us some really helpful tidbits and good questions to think about. So I appreciate that very much. We are able to entertain questions now at the end. So as people are typing questions into their question box, which then I will relay to Lily to answer for the most part, I welcome anyone to add or coming in. So the first easy question is, yes, we will be emailing out an archived presentation with the slides. So they'll be sent out within the next day or two. If you do not get them, please let us know, but it should be pretty automatic. We do have a question about the ID cards.
Yeah.
So the question reads, how can we make sure that a code belongs to a specific person without having to record the name of the person in our office and to maintain anonymity? Which is a great question, so I'm going to pass that on to Lily.
Well, so there's a little bit more to your question, too, about having cards destroyed or not being able to hold on to them. Some programs try and preempt that by laminating cards or providing plastic cards that are a little bit sturdier. It depends on your program and kind of the size of the program and how many people you're seeing. If you're a smaller program, the person doing intake and having conversations with people about the supplies they're looking for may recognize every person who comes in and have those personal relationships and being able to confirm to law enforcement that someone is indeed a participant. I believe the North Carolina Harm Reduction Coalition includes demographic information. I think it's kind of an age range, gender, and ethnicity, I believe, that's included in their participant ID, so that you can get a pretty good sense of if the person is the person on the card or not. they should, I don't know,
So,
I hope that's a good start.
Yeah, and so one of the things that Lily's done a really great job of is collecting resources that are already out there. So yes, it can feel daunting to set up a program, but because we already have 21 active syringe exchanges in North Carolina, there's a lot of really great resources that have already been created. And so I think law enforcement are increasingly recognizing the North Carolina Harm Reduction Coalition logo, for example. There is a template of an ID card on our website that you are welcome to use and put your own information on. And so I think that might, a little bit of the brand recognition or co-branding would be helpful, I believe, to trying to prevent some of that that skepticism.
You can also circulate, absolutely, you can circulate a copy of your card when you submit your security plan to say, hey, just FYI, everyone in this agency or everyone in this office, if you see a card, we are standing by this. This is someone who's involved with our program. I think that's a good way to encourage the educational piece as well.
We have another question that's come in. So are health departments required to report to you all on their syringe exchange program?
Yes. In addition to just being really excited to see health departments taking on these programs and to help them put together a syringe exchange program, the law requires all programs, not just health departments, to submit one of those sign-up forms and to participate in annual reporting. How much you want to be in contact with our office beyond that, it's really up to you, and we're happy to help with other things and answer other questions, but for the most part, I think programs are operating pretty autonomously.
So yes, it is required by law for any active program to report to the Division of Public Health. But like Lily said, we try to make that as not so burdensome as possible. We have another question about funding in general. Do you have any insights on funding?
So perhaps not shockingly, these syringe exchanges don't have a ton of private funding opportunities. There are a handful of organizations and foundations that provide funding that can be used for syringe exchange programs. There's a funding document on the NCSSI website that has links to some of those programs and information about that grant process. Beyond that, it was a big step to open up local funding to be able to be used for syringe exchange supplies, not just program operations, and hopefully, more avenues for funding will be available in the future as these programs grow and as we're able to show the great work that they're doing.
And we're doing our best to keep our eyes open also for funding for across the state. So if anyone hears of anything, please let us know, and we would be happy to explore or partner with other funding. Happy to provide letters of support if people are applying to local foundations and other groups. So we have just a few more minutes. So there is a clarification. Thank you so much for sharing, Michael. It says, yes, North Carolina Harm Reduction Coalition has a naloxone log with initials, year of birth, gender, and race as a way of tracking demographics for their syringe exchange participants. Thank you for that. Does anyone else have other questions at this time? All right. Well, Lily and of course the rest of our team, including myself, Nidhi Sachdeva, is willing and happy to answer questions as you go along. We will be doing some specific outreach as a result of the annual reporting results that we found. So please be on the lookout for us. We're really excited to bring some of this technical assistance to all of you. We really appreciate all the work you guys are doing at the local level. We're hoping that this is going to be another venue and tool for us to combat the opioid epidemic in North Carolina, as well as take advantage of a lot of the other public health programs and services that we already do so well with disease transmission prevention and linking folks to services and building partnerships and whatnot. So thank you, thank you, thank you. We hope you'll tune in to the next CDI section webinar series. which will be in September, so keep a lookout for that one. But I hope everybody has a wonderful day. Thank you, Lily, again for your work and your expertise that you shared with us today, and I hope everybody has a safe and happy Thursday. So take care, everybody.
Bye.
Bye-bye. Thank you, thank you.